All cancer journeys are difficult, but for our guest, hers was made more difficult by a misdiagnosis and a relapse. This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. It was a challenging process, but Amanda Ferraro of Manalapan, New Jersey, survived acute myeloid leukemia, and we're going to hear her story, a story that inspired her to write a book. So here she is, and Amanda, welcome to Cancer Interviews.
Thank you very much for having me.
Amanda, we want to start off first off by finding out more about you, your life exclusive of cancer. So if you would, tell us about where you're from, what you do for work, and what you do for fun.
My name is Amanda Ferraro. I live in New Jersey. We're over here in Monmouth County. For work, I'm a patient advocate. I work with cancer patients as well as governments and policymakers to make laws to help cancer patients, whether that is during their cancer journey, for early protection, or in survivorship. And for fun, I love playing the piano. I am one to sit on the beach in the summer, in the sun, of course with my sunscreen on and an umbrella just in case. I do wear UV protection clothing as well. And I love watching my son play football. It's one of my favorite things to do. I love being a mom and being able to do all of those things with him.
Now, Amanda, in terms of making new law, you would think that any new law that adds protections against cancer or changes things in a good way, you would think that that would be very, very bipartisan. Do you run into much of a challenge with this sort of thing?
Yes, so it does depend on who starts the bill. A lot of times there have been one party producing it, signing it, having their colleagues join, but then the other side has chosen not to, or they would like more information. But for the most part, cancer policy is bipartisan. I think both parties, or I should say all three, independent, Republican, and Democrat, all really do come together to help cancer patients on laws. The difference between the parties is checking the bill, reading it over, wanting time to edit things in there. That's pretty much the most that I have seen. But I hope that no matter where you are in the government, you would want to help cancer patients, whether that's prevention, during their journey, or survivorship.
Now, let's talk about your cancer journey. For all of us who are cancer survivors, there was that point in time in which we noticed something wasn't quite right, something that was going to require medical attention. For you, what was that moment like? How did it manifest itself?
So I was not feeling well March of 2017. I had went to the emergency room after feeling very fatigued and tired and a little drained. We thought it was just me not having enough sleep. I had a 3-year-old, but my mom took me to the emergency room that night just to get checked out. And they told me I had mono, which was understandable diagnosis because I had all the symptoms. He told me to get a cardiologist and have an appointment because I was having some flutters in my heart, but we were just going to have it checked out and eat some red meat and go home and you'll be feeling fine in about a month. That's what I was told my very first time. Over the past 2 months after that, April and the beginning of May, it kind of really got worse. My symptoms grew. I had bruising, very lethargic. I was very pale. I couldn't catch my breath when I was walking, no energy. And then I decided one night that I was going back to the emergency room because at that point I felt like I was dying. And so I went back to the ER and I explained to them what was going on. And I was very lucky to have a different doctor this time. He listened to me, thankfully, and did blood work and went back into the files to look at my results from March. And that is where he found I did have 15 blast cells in my blood that was overlooked back in March. And that because of me living with cancer for 2 months without it being checked on, it was so bad that my hemoglobin was about a 5.2. And the doctor in the ER said if I waited to go to the hospital, I might have passed away in my sleep that night.
So what phase, what procedure did this good doctor recommend as being next for you?
So in the emergency room, he suggested that I had to have the blood transfusion because of my low hemoglobin. In the CBC and the metabolic panel that he ran on my blood, they found, I believe it was almost like 84 blast cells. And blood cancer is a little bit different from breast cancer or colon cancer. When you have blood cancer, it's basically your whole body. And you start off with stage 4 because it already has metastasized. Where your blood goes is where the cancer goes. So in blood cancer for leukemia, there's not stage 1, stage 2. It's basically you're at stage 4 from the very beginning. So I had the blood transfusion and I waited overnight in the hospital to see the oncologist the next morning.
Now, in learning a little bit about your story, I also heard that part of it was undergoing a bone marrow biopsy. For listeners and watchers who are really hanging on everything you're saying, Amanda, because your experience could be their experience, how difficult was the bone marrow biopsy?
So I have heard about bone marrow biopsies before, but I wasn't sure what it was. It is basically a needle that's quite large. I would say maybe 7 inches long. And the doctor takes kind of almost like a screwdriver and will put it into your bone. So here's the bone and here's like the screwdriver. So they got to screw into your bone so that they're able to stick the needle inside of the bone in the marrow so they can suck it out. It is extremely painful. So for adults, they do not put you under for that. It is basically a surgical procedure, but they do localized numbing. So I was numbed and they put the needle in, or the screw first. Then they put the needle in. And when he was withdrawing it and taking the marrow, it was the worst pain I had ever experienced. It almost felt like my bones were crushing where he was doing the biopsy. And it felt like an elephant was sitting on my leg and my bones were like about to rupture. That's the best way I could explain it. It is intensely painful to have that procedure done.
By the way, we're confident you'll be able to learn some tips and tools that can help you along with your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share this story, Amanda's story, with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we post an interview. And if you or a loved one are facing a cancer diagnosis, click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew When I First Got Cancer. And Amanda, for you, when you first got cancer, we've done more than 100 of these interviews, and your situation may be unique compared to all of them instead of you're anticipating cancer and somebody tells you you have it, in your case, you found out that you had been walking around with it for like 2 months. How difficult was that to process?
It was very difficult for me, mainly because my sister has had cancer when she was younger, so I was able to kind of see what she went through. There's been cancer throughout my family, and with each of those cancer diagnoses, there was a tumor and there was, doctor's appointments and MRIs or CT scans, and there was waiting for results. I went to the hospital because I thought it was something else and learned I had cancer. It literally changed my life, those 3 words. My life went from, I was a full-time stay-at-home mom with my 3.5-year-old son, to now I'm a cancer patient and I'm needing full-time care, and life is a little bit different now.
So now that you learned you had cancer, it was going to have to be treated, and there would have to be a treatment regimen. So what was your treatment regimen?
So I decided to get a second opinion on doctors, facilities, hospitals, and treatment plans. So we left one hospital and went to another hospital, and that was the first thing I did. That is where we ran a lot more testing, some more blood cultures. We did more metabolic panels. They looked at HLA factors in blood, how fast the blood produces, how high the white blood cell count was. Like, they ran so many tests. That is when we found out it was AML leukemia. And those doctors at that hospital said that they felt uncomfortable treating me because of how bad the cancer was. So we got a third opinion. And that is how my regimen started, was getting a second opinion and then a third opinion. Because I wanted to go to the best hospital that there was, and I wanted the best doctors that I could get, and ones that had amazing bedside manner and that would speak to me the way I wanted to be spoken to. And I wanted to be a part of my cancer journey. So we ended up arriving at the third hospital about a day or 2 after I found out it was leukemia. And this doctor, absolutely amazing, my oncologist. So the day we arrived, my mom, my dad, my son, sister, my stepfather were all in the room, and my oncologist explained to all of us what my regimen was going to be, what he was expecting, the time he was expecting it to take, and was open and honest with all of us. So we knew that for leukemia, you have induction chemo, which I went through. They give you, I had cytarabine 7-3, which is basically a week plus 3 other days of chemo. And that was first. Then after that, I had to stay in the hospital until all of my counts came down, which usually happens a week or 2 after chemo. And during that time, I would have blood work every single day to monitor my counts, and I had to take my medications, and I basically just waited until all of my counts went down so that they could bring my counts right back up. And they checked every single day for blast cells and white blood cells and my hemoglobin. And they wanted to monitor what my body was doing. And that is why I had to stay in the hospital for 33 days. That was my very first induction chemo. Then after my induction chemo was over, I was able to go home, but I had to go back and forth to the hospital every other day for blood work to see if I needed a blood transfusion or a platelet transfusion, and they just wanted to monitor me. So once my counts came up a little bit, then they made it every 3 days. And then once I was over that 3-day hump, I went once a week. And then once my counts came back up to normal, I was once every month. And then once everything was good, I had to go back in for consolidation therapy, which is almost about the same as induction chemo, except for you get to go home after the week. So I would have chemo for 7 days, and then I would be going back home. And then I would have to go back to the hospital every other day. And then once my counts got to a certain point, it was every 3 days, and then once a week, and then once a month. And I had 4 consolidation therapies. So I was diagnosed May 17th of 2017, and I was told I was cancer-free February 14th of 2018.
Now, as you went through chemo, we've had many guests who have gone through chemo, and to varying degrees, it's unpleasant for everybody. In your case, what was, from a physical perspective, what was the toughest part of your chemo experience?
So I think I have 2. For me, my appendix almost ruptured 4 days into starting chemo. So I had to have an emergency appendectomy, which was very scary because the hospital where I was treated never had surgery on an active chemo patient before. And that was because of the chemotherapy. It did a toll on my body, and unfortunately, my appendix couldn't withstand it. So I think that's probably number 1, because that was very scary for me, as the hospital didn't know if I was going to make it through surgery, and they couldn't just let it rupture because that would cause sepsis, and then I could have passed away from that. So that's definitely number 1. But the worst side effect I had, other than my organs not wanting to work with the chemo, would definitely have to be the fatigue. For me, the fatigue was the worst part. I was in the hospital for a long time, but I would call my son every single day, and I had a schedule for myself, and just getting up to go to the bathroom was so difficult, and I was in so much pain, and I just feel like the fatigue made it so much worse for me.
Now, let's talk about another component. You briefly mentioned your son, but while you're going through all of this physically, what about the mental and emotional piece with your going through this and being a mom?
Yeah, when I was diagnosed, I felt like I was the only person in the world that this was happening to. And I felt like a horrible mother. I knew that my son was going to feel abandoned. I literally put him to sleep one night, and I didn't go home for like 35 days. So there was a lot of emotions there. I just felt like I abandoned my child. I felt horrible because it was out of my hands. It wasn't my choice to have cancer. So it was something I had to face, but I didn't know how to explain it to him. I didn't know what my life would look like. I didn't want to make promises that I didn't know I could fulfill, because I didn't know what was going to happen. And I had to be strong for him, or I thought I had to be strong and show him that it was okay and I wasn't going to cry and that everything would be fine. I quickly learned that that was wrong, but in my mind, I felt like I had to be the strong mom and show my son that everything was going to be okay. And it took a huge mental toll on me, because I knew that I couldn't promise anything, and I didn't want to lie to my son, but there was this fear of the unknown that was lurking at every corner, but I didn't know how to express it to him. He was 3.5, and I felt very alone, and it was so difficult. I think I cried myself to sleep almost every night. I would cry after getting off the phone, and he didn't understand why I was away. So phone calls would be him crying, begging me to come home, apologizing for being loud or making a mess. And he would cry that he would be a good boy and he was so sorry. And him just not understanding that it wasn't his fault was difficult as well. And I would recommend therapy or talking to a therapist for anyone going through this with children, because it is very, very difficult.
Now, Amanda, as if all this weren't enough, at some point you learned that you had a relapse. Could you tell us about that and just how difficult that was? Obviously, it was difficult, but we'd like you to quantify just how tough it was.
Yeah, so when I relapsed, it was about 6.5 months after learning I was cancer-free. I was on my stepdad's boat, and all of a sudden my face started swelling and I was having tooth pain. So we rushed back to the marina, and I brought my son back home, and my fiance came home from work, and I went back to the emergency room because I thought it was my tooth. They checked me out. They did blood work. They found one blast cell in my blood with the CBC, and they saw that my tooth actually had an abscess in it. And he said, the doctor at the hospital in the emergency room told me that he contacted my oncologist, that I had one blast cell in my blood, but I did have an abscess in my tooth, and I had to get that fixed before I could go through any other testing. So I was released from the hospital that next day. I spoke to my oncologist, and he said, let's not panic, but we're going to do a bone marrow biopsy to see what your marrow looks like, and we'll go from there. We're not worrying about a blood test. So he kind of calmed me down a little bit and told me to get my tooth in order. I had to go to a dentist. I had the tooth pulled, and then we had the bone marrow biopsy. So I found out on September 11th of 2018 that I indeed did relapse. And then my doctor gave me 1 week to get my affairs in order. He said that when chemo doesn't work for leukemia, and we found a genetic mutation, which is TP53. So with the TP53, which is cancer causing, and the leukemia coming back, my oncologist had given me a 10% chance to live, and said to make a will and prepare my family. And he gave me 1 week to do that. And on September 17th, 2018, about 9 days after my son started preschool, I went right back into the hospital for my second induction chemotherapy. That chemotherapy was done with stronger medication called MEC, MEC. And we needed that because of the genetic mutation that was found. A lot of times in leukemia patients, they find TP53 that is mutated, but it's just in cancer cells because it's a cancer-causing mutation. Everyone has it in their body. It just, when your cancer comes out or when that gene is mutated, you usually develop cancer. And there's certain types of cancer for this mutation. There's leukemia, carcinomas, sarcomas, breast cancer, skin cancer, and I believe cervical cancer as well. So we found that we had that mutation. My mom, my grandmother, my sister, we all got tested for it. And during my chemo, we found out that we are one of 5 families in North America that have this gene mutation that is generational. So it's from my grandmother has it, I have it, my mom has it. So we found that out during my induction chemo. Because of this, my doctor wanted me or told me I was going to need to have a stem cell transplant in order to save my life, in order to have any chance of survival. That was going to be the cure. And so I would say about 2.5 weeks into my induction chemo, my doctor started to look for a stem cell donor through Be the Match. So after my induction chemo was over, I was able to go home to my son, and it was October 22nd. And we found out I had a donor, I think about a week or 2 later. And I was so happy and so amazed that someone would be willing to donate their stem cells to me. I was so grateful because it was a cure for me. It was someone was giving me the gift of life, which is so amazing. So I went back into the hospital. In 2018, it was the day before Thanksgiving, so it was November 21st. And I had to do, so before you have a stem cell transplant, they make you do chemo. And the chemo regimen for that is very, very strong and harsh, because what they do is they try to get all of your counts and your immune system to basically zero, so that when they give you the new stem cells, they can start working right away. So the chemo was so rough for me. It was very rigorous. I had a lot of burning diarrhea, throwing up, so much fatigue. I was very, very, very sick during that. But once I got the stem cells, everything was great. And I felt like it was a miracle. And then after you get the stem cells, so hospitals do it differently, and they have different regimens that they like to do for stem cell transplants. In my hospital, they give you chemo, I think it's 5 days after you have the treatment, and that's to help engraft, which is basically having the donor immune system learn your body and take to your body a little bit easier. And it helps if they give you that chemo, because it's basically trying to whip the new stem cells in shape and say, hey, I need you to work. And so that's the regimen they did at that hospital. And then after I received the stem cells, it was learning my body all over again. I was able to go home December 19th, which was amazing because my son's birthday is the 24th of December. And then I was able to be home for Christmas for me. And it was a long road because it was induction chemo. I was home for 3 weeks and then went right back in for the stem cell transplant. But I was so grateful, and I was determined to do anything possible to get that cure.
Now, Amanda, let's think of your health today and then compare it to your health pre-diagnosis. If we could say that pre-diagnosis you were 100%, today what are you?
Well, it depends on the day. Today I would say I am at 90%. I'm having a good day. I don't have any side effects. I'm able to walk around, enjoy the weather, and I'm talking to you, which is awesome. Now, because of the stem cell transplant, I have something called graft versus host disease, which is the donor's immune system. So my stem cell donor, his immune system attacks my body, and that causes flare-ups. So I do have bone and joint graft versus host disease, which is like all of my joints swell. They could be very painful. Sometimes I can't walk. I get very stiff. I also have pre-osteoporosis. It's like 1 point before osteoporosis. So I've started treatment for that. And that causes pain, a lot of pain. I have mouth graft versus host disease. So that is dry mouth. Sometimes my tongue twists and I fumble over words. That's just from the dry mouth and the graft versus host disease. I do get sores sometimes. Sometimes my tongue will swell. And I have gut GVHD. Sometimes I can't eat certain foods. My stomach will swell to look like I'm almost 6 months pregnant. And that hurts. That's very, very painful when it happens because it happens very, very quickly. And there's nothing to prevent that from happening. It's just my body. A little bit of GVHD is good because you know the donor's immune system is working, but then too much GVHD is bad. So there's always monitoring, having conversations with the gastroenterologist, my oncologist, the dermatologist, the orthopedic, just, making sure that my body can function at maximum or what I can do on a daily basis. Sometimes I am in bed during the day. If I push myself too much, or let's say if we, went to the amusement park and I had to walk around the whole amusement park that day, for the next 2 or 3 days, I would know I would need to take it easy because my body needs to recover from that. And that's from having cancer and the graft versus host disease. So it really does depend on the day. Some days are better than others, but I'm alive. I'm here today to talk about it. So whether I have a bad day or a good day, I just try to focus on my blessings.
All right, Amanda, we're going to wrap things up. And before we do, we want to go back to something we mentioned right at the top, and that is your book. If you would tell us about your book, its name, and what it's about.
Yes, so I was very lucky to co-author a book. It's called Perspectives on Cancer, Volume 2. You can go get it on Amazon. There's an ebook and there's a paperback. I do have copy here if you would like to see what it looks like. Let's see if I can grab it. It's right behind. So that is called Perspectives on Cancer, and it is under Tim Soanes as author. He is the man behind the book. It was his idea. So it's a book about cancer perspectives. It is from cancer patients, cancer caregivers, survivors, and people going through active treatment. And it is different perspectives of what you went through and how you overcame it and what has helped you. And there are so many amazing authors in this book. I am so lucky to be able to be a part of it because all of our journeys are put together to help other people. And just the feedback we've received so far with helping people and people knowing that they're not alone in what they're going through, or maybe they felt alone because they were a mother or they were a single parent or they didn't have insurance and they didn't know how to navigate it. But by being able to share our stories, people can realize that they're not alone and there are other people that have gone through what you've gone through. And I'm so grateful to be a part of it because I love helping other cancer patients. And I feel like this book is definitely helping so many people. But one day I will have a book, an autobiography. I've definitely started it, and that'll come out one day.
She is Amanda Ferraro of Manalapan, New Jersey, and she shared a tremendous story with us as a two-time survivor of acute myeloid leukemia. And Amanda, we thank you. We'd like to thank you so much for sharing your story with us. Thanks very much for being with us on Cancer Interviews.
Thank you so much for having me. I appreciate being here.
And we want to remind you as we conclude, as we always do, that if you or a loved one are at a cancer interview, you are not alone, as Amanda has just articulated. There are people out there like Amanda. There are people like her co-author, Tim Sohn, who have information and inspiration that can ease your cancer journey. So until next time, we'll see you on down the road.